as far as pain goes, you have to decide, is it worth it or not? And the value in that is it worth giving up going to the grocery store? Is it worth not playing tennis anymore? I can't answer those questions, but if you can answer those questions and you say, you know, I didn't really realize that I've given up all those things, or I don't want to give those things up anymore, that's when you need to come back and see somebody like me. Every patient is an individual. So what we do is look at every single patient as an individual person. It's not cookie cutter. We find out, number one, what's causing the pain. Because if we don't know what's causing the pain, we don't know how to treat it. So one, we'll find out what the cause is, and then we can do specific treatments. And that might be medication, it could be injections, it could be physical therapy, and certainly lifestyle changes are very, very appropriate. I can't guarantee, certainly would not guarantee, that we're going to take all your pain away. It may be physically impossible. So we have to have some reasonable expectations, but we'll do everything we can to eliminate if possible, but certainly try to reduce the pain to manageable levels so people can get on with their lives. My experience has been that after I graduated from medical school, even before that, I was in the Navy and I was a hospital corpsman with the Marines during Vietnam. And then they put me through medical school, and I was in the Navy for almost 20 years before I got out. When I got out, I needed a job, and there was Lubbock, so they called me. I was in Lubbock for nearly 25 years, and one day, Hill Country Memorial called me and said, would you like to come down here and work? And then, everything just fell in place. This place has an excellent reputation. There's only very few hospitals in the country that have a reputation like this, and particularly in a small community hospital, it's almost unheard of. So for me, not only was it the medical community was some of the best in the country for what they could offer, but just lifestyle changes were what we needed and wanted at this time.